Barbara Kelley is the Executive Director of the Hearing Loss Association of America, where she has served in various capacities over the past 28 years. The association's mission is to open the world of communication to people. The association impacts communication access, public policy, research, public awareness, and service delivery related to hearing loss. Its national support network includes an office in Washington, D.C., state organizations and HLAA chapters, and state organizations across the country. Ms. Kelley will discuss HLAA's work in making hearing loss a public health priority and some lessons learned for eye and vision health.
Hi. I want to thank the committee and the study staff for inviting me today. And I think that the idea was to have another group who represented another sensory disability to come and speak to you and talk to you about our experience. HLAA, the Hearing Loss Association of America, is a national nonprofit organization, and our membership, and we represent people who have hearing loss who want to use technology and stay in the hearing world. Not so much the smaller group of people who are born deaf or culturally deaf and use sign language, but these are people who wear hearing aids, cochlear implants, and want to stay in the hearing world. We had a National Academies of Sciences, Engineering, and Medicine report on accessible and affordable hearing health care for adults. And our study came out last June, and we had our meeting like this last December. I was really fascinated to read the report on vision and the recommendations. And as I'm sitting here, I'm really stunned that having good vision care is lacking, and it's really for people who have privilege. And I grew up with very good vision care from a very early age. And believe it or not, when I was young, wearing glasses, there was a stigma attached to that, much like there is a stigma attached today about wearing hearing aids. So I am really happy there's no longer a stigma because I own about 10 pairs of different glasses, and I enjoy wearing them as well as my contacts. But even today, there is a law for babies born, and in most states, the newborn hearing screening, that within a day of giving birth to your child, the child is screened for hearing loss. And I remember when I had my son, he was screened. I was very happy he passed his screening. And then I didn't give vision another thought, even though I wear corrective lenses. My husband wears corrective lenses. I never gave it another thought till he had his well child visit, probably age 5 or 6, around there. And they did his first vision screening. And they said, oh yes, you better take him to an ophthalmologist. He needs probably some glasses. So I took him, and yes, he needed glasses, and he got his new little glasses. And on the way home, he was wearing them. And I think this is where the impact came for me, as well as the guilt. He was looking around and he said, Mom, the world is so bright. And I thought, how long has it been for this child where the world wasn't bright? And it made me think about, did I really get a vision screening soon enough? And especially knowing my vision and my husband's vision. So this report is really, really important. And when I was reading the recommendations and hearing what everybody is saying, I think I could go down the list and show parallels to the vision study and the hearing loss study. It's really stunning. When I saw Jeff Todd's slide on 500 Cities study and all the health issues that were listed, and vision was not one of them. Hearing loss was not one of them either. 48 million people in this country have hearing loss, and it's third in line after arthritis and heart disease. So why isn't it part of that slide? I'm going to find out. I'm going to follow up with that. About 86% of people who would benefit from hearing aids in the United States don't get them. Why is that? Affordability is one of the main reasons. Hearing aids are not covered by Medicare. Most insurance policies don't cover hearing aids. Hearing aids are covered under Medicaid for children in some of the states, and hearing aids are very expensive. The business model currently is based on low volume, high cost. So unless you can afford a couple $1,000s a piece for each ear, you really can't get hearing help. One of the main, I've been with the organization for over 28 years, and all through the time, one of the main phone calls we get from people or inquiries is, I need help affording hearing aids. So this study on affordable and accessible hearing health care is our blueprint, like it is yours. For HLAA, it's providing the framework for our work going forward. And I can't tell you how important the consumer groups are in this. We were the only consumer group sponsor of that study, along with DOD, the CDC, the Department of Veteran Affairs, the FDA, the National Institute on Aging, and the National Institute on Deafness and Other Communication Disorders. But it's the consumer groups that have the power to move this forward. And why is that? Because we have no financial interest in any innovative technologies that might come out. We have the interest of the consumers and the experiences. And the one thing that I would like to say about hearing aids that is different from eyeglasses, that in most cases, glasses do correct your vision. Hearing aids do not correct hearing. So it's a little different. However, this report has really gotten action very quickly. The FDA has already removed the requirement for a medical evaluation and waiver to get hearing aids, and that was recommendation number 3 of the report. Recommendation number 7 is for the FDA to open up a new category of over-the-counter hearing wearable devices. And believe it or not, that is, I mean, the train is inching out of the station, so much so that Senators Warren and Grassley have introduced a bipartisan bill to create an over-the-counter hearing aid act. And the FDA is very much in favor of this because that will make their job easier, especially when it comes to the states. So already we're seeing how much weight our report has caused and has encouraged action. So my light is red, so if anything I want to give you as a takeaway is use your window of opportunity. Don't delay on taking action. We're going to lead the public information campaign on hearing loss and engage consumer groups, advocacy groups, your NGOs, and don't rest, because I see already what this report has backed up with scientific evidence, all the things that we already knew, right? So it's very important, and I'm very thrilled for your report as much as I am thrilled for our report. And thank you for having me.
Thank you.